All right, I think we have everyone from the waiting room, so we can get started. All right, so welcome everyone to our Connection Cafe. Today we're going to discuss health literacy-based strategies for COVID-19 communication. All right, so next slide, please. All right, we're going to first introduce ourselves. So my name is Kim Hassel. I'm a Senior Health Communication Manager at Communicate Health. I'm joined by a few of my colleagues in a partner organization. I'll first pass it over to my colleague Kathleen to introduce herself.
Thanks, Kim. My name is Kathleen Walker. I'm a senior content strategist here at Communicate Health, and my role is to create health content that is easy for as many people as possible to understand and use. And I'll kick it over to Michaela.
Thanks, Kathleen. Hi, everyone. I'm Michaela Moma. I'm a health communication associate here at Communicate Health. And I work a lot with folks like Kathleen to help kind of keep all those projects moving as we're working on that plain language work.
Nicole, could you introduce yourself next?
Sure. Hi, I'm Nicole Baker. I'm a research associate at Communicate Health. And so work a lot with the communications team, just testing different things. So it's very, very exciting. But I'll pass it over to Heather.
Hi, everyone. I'm so thrilled to be here. We had the honor of working with Communicate Health on a project for our campus COVID-19 vaccination and mitigation initiative. So I'm with the American College Health Association, and we support campuses nationwide in advancing the health of their student population.
Thank you. All right, next slide, please. So for objectives for today's session, so after today's session, we're hoping you'll be able to identify common obstacles that health communicators may face when creating COVID-19 content, describe health literacy-based communication strategies that are relevant for COVID-19 communication projects, and identify ways to apply these strategies in your own COVID-19 communication work. All right, next slide. So a little bit more about Communicate Health. So we are a small women-owned health communication agency. Our goal is to make health information accessible and easy to use. Everything we do is grounded in health literacy and clear communication best practices. And we follow a human-centered design process. And that means we put our users' needs first in everything we create. We test our materials with people in our priority audience and make revisions based on their feedback. And this process helps us make sure that everything we create really meets our users' needs. All right, next slide. And as Heather mentioned, she works for the American College Health Association. And I will pass it over to you, Heather, if you want to say anything a little bit more. We have a little bit of an intro here on the slide, but Heather and Communicate Health partnered on some of the work that we'll be sharing with you today. But Heather, anything else you wanted to mention about your organization?
No, thank you.
Great. All right, moving right along. So today's agenda. So first, we're going to explore how we've used health literacy and human-centered design best practices to address some of the health communication challenges that have come up during the COVID-19 pandemic. Then we're going to break into small groups and to talk about your experience communicating about COVID-19. So we're really excited to hear about some of the projects that you all been working on, some of the challenges that have come up for you, and some of the strategies that have worked well. And finally, we're going to come back together and share some lessons learned to the whole group. And so hopefully you'll all leave this Connection Cafe with some inspiration or new ideas to try out. So during the pandemic, health communicators faced a ton of challenges. So researchers are still learning about COVID-19 every day, and communicating about a new health topic with a lot of unknowns is always going to be difficult. And as we learn more, we've changed the way we talk about COVID-19 and shifted our communication strategy. As experts have learned more about COVID-19, public health guidance has shifted a lot as well. So for people who aren't familiar with scientific process and how we learn about diseases, those shifts can be confusing and can lead to distrust. And we all know misinformation about COVID-19 and vaccine has been a big source of concern over the past 2 years. And we've talked about this even yesterday in some of the sessions as well. And in fact, addressing misinformation is a common thread that came across several of our projects that we'll share with you today. And I think we can all agree that COVID-19 has become a really politically polarized topic. It's become more difficult to communicate about COVID as basic public health measures like vaccines and masks are seen as part of a political agenda. And gaps in science and civic literacy has contributed to COVID confusion as well. And as I've mentioned, when people aren't familiar with how the scientific process works or how the government plays a role in vaccine development and distribution, that can lead to mistrust as well. And finally, we have a rapidly evolving information landscape. And especially in the early days of the pandemic, people were getting so much new information about COVID every day. And 2 years later, our understanding of the virus and public attitudes about COVID-19 continue to evolve and change. So I'm now going to turn it over to Kathleen, and she's going to take us through a few case studies of some of our COVID-19 communication materials that we created.
Thanks, Kim. So I'll share a few examples of COVID communication materials that we've worked on. And for each one, we'll focus on some key takeaways that can inform other COVID-19 communication projects. So the first project we'll focus on today is Sarah Alert, which is a symptom reporting tool that's created by the MITRE Corporation. So basically, here's how it works. If you have COVID-19 or you've spent time around someone who has it, your local health department might ask you to report your symptoms using Sarah Alert. And some locations might require travelers to complete a daily self-report using Sarah Alert too. So Sarah Alert sends people a survey every day for about 2 weeks, and they report their COVID symptoms. And folks can choose to get that survey by email, text, or an automated phone call. So it's basically a way for local health departments to keep track of COVID cases in the area and monitor symptoms. So the audiences for Sarah Alert include people who have COVID-19 who are reporting their symptoms, close contacts, travelers, and health department employees. And the MITRE Corporation turned to Communicate Health to make Sarah Alert easier to use. So here's some examples of the materials that we created for Sarah Alert. First, we created these symptom pictograms, which are small pictures illustrating COVID-19 symptoms. And these appear on the survey where people respond about what symptoms they are having every day. And the pictograms just make it easier for people to identify the COVID-19 symptoms at a glance and make it easier for everyone to use the survey. We also revised some communication materials around Sarah Alert. So first, this is an example of an email that people get when they're enrolled in the Sarah Alert monitoring system. And we revised the language to make it a little bit more personal and to more clearly explain what Sarah Alert is and what the local health department is asking them to do. So here's some examples of how we incorporated a human-centered design approach into the materials that we worked on for Sarah Alert. With both the pictograms and those communication materials, we conducted user testing with consumers and health department employees to make sure that all the materials were easy to understand and use. And for the pictograms specifically, we tested those with audiences and users who speak English as a second language, to make sure that they were easy to understand and didn't have any unintended cultural interpretations, that everything made sense across language barriers. So revising those materials based on audience feedback helped us make sure that they appealed to everyone and were easy for everyone to read and use. So some key takeaways that we learned from our work on Sarah Alert. First, well-designed pictograms make symptom reporting easier. So as I mentioned, pictograms are helpful for people that may speak English as a second language or don't speak English, but they can also be helpful for people who might have intellectual or developmental disabilities or people who have low literacy skills. So across the board, they help to communicate symptoms. And like I said, they also help to reinforce short symptom descriptions for everyone and just make it a little bit more of a personal experience to complete the symptom survey. And warm and personal language also helps people understand what they need to do. So using people's names rather than a code in the greeting in emails, text messages, etc. Using a little bit more warm and personal language rather than clinical language to explain what Sarah Alert is and why people are being asked to report their symptoms, help people understand what they needed to do during the time that their symptoms were being monitored. So this work was actually completed pretty early on in the pandemic in early 2020, or the fall of 2020, as a lot of health departments were just putting the infrastructure in place to be able to track COVID cases and symptoms. So this informed a lot of the projects that we worked on a bit later on.
Kathleen, before you move on, we have some questions in the chat about the testing that we conducted for Sarah Alert.
Sure, yeah.
Could you chat a little bit about, maybe expand a little bit more on the testing that we conducted in speaking to how we got audience feedback? Was it a specific questionnaire? Did we ask open-ended questions? Things like that. Maybe just give a few highlights of that research and we can move on to the next item as well. I think we'll also have time for questions at the end as well, but since it's in real time, I wanted to be able to make sure we got some questions answered too.
Yeah, that sounds great. So as far as the pictograms, we actually conducted testing with a couple of different pictograms or illustrations for each symptom. So we could see which version of the picture was easier for people to understand. So we actually shared different versions of these pictures without giving any context or explaining what they were supposed to represent. And then asked people to give us their own definition or interpretation of what those pictures meant. So then based on that, we were able to identify some that there were some pictograms that people didn't understand, that maybe the illustration needed a little bit more context, or there were some abstract elements that didn't really translate. So that helped us refine the pictograms based on people's interpretations and see what translated across cultures and languages. And we also did some user testing with those written communication materials to be able to see where language resonated with people, if there were some explanations that worked better than others to help people understand what they were being asked to do. So we had not necessarily people who have had COVID, but just people that align with the priority audience of people who might use Sarah Alert, read those messages and give us their feedback on what they would change or if there's anything that they would say differently. We also did A/B testing, showing people two different versions of those messages and getting their responses on which version they liked better or what they felt was more effective. So any other questions on testing?
Maybe another question in the chat about who specifically we were testing with. Were they patients? Were they like who specifically were they? And it looks like another question about, was it a focus group setting or was it more of an in-depth interview setting?
Sure. So for both the pictograms and the communication materials, we did both more of an in-depth interview setting, so one-on-one testing. And as far as I know, these were not necessarily people who had COVID or knew someone who had COVID, just generally people that MITRE had contact with through recruiters. And for the pictogram specifically, we looked for participants who spoke English as a second language. So any other questions? Let me see if there's a chat here. Oh, perfect. Let me see if we can still see our slides here. Okay. So moving on to our work with the American College Health Association. So for the American College Health Association, the CH team worked to create resources to help campuses promote COVID-19 vaccination and mitigation. And our audiences for these materials included some students, faculty, and staff, with campus communicators as information intermediaries. So campus communicators are campus staff members who work on college campuses that are doing COVID communication for their campus community. And so they kind of served as intermediaries to distribute some of these messages and materials. Heather, do you have any context that you'd like to add around your goals for this work or the campus audiences?
Sure. So ACHA is a membership institution. We have around 8,000 members at a diverse array of institutions of higher ed across the country. And specific for this project, we have an online community of practice with over 10,000 members, all folks who have signed up to share information with each other on best practices and kind of mutual support around COVID mitigation and vaccination on campus. Each campus has their own story, their own policies, their own impact of state legislation. So it was very challenging to balance something that was broad enough to benefit our really diverse membership while still having room for them to tailor and be specific to what their local community needed. So I think it was a tall order, but CH did a great job with it. We had two projects in the first year. And so one was specific for student ambassadors. So knowing how overwhelmed the workforce was in almost every sector, but also specifically at that intersection of higher ed and healthcare, we wanted to give folks a tool that they could use with an existing resource. So many campuses already have existing peer education groups. They might be student health educators, could be the RAs, it could be student government, lots of different peer-to-peer opportunities. And so we had a student ambassador toolkit specifically around COVID mitigation that was meant to help very busy campus administrators kind of pivot from whatever topic those students were working on. It might have originally been alcohol or preventing violence, preventing hazing, et cetera. They were able to kind of repurpose that student energy through the student ambassador toolkit. And then the other project that we did in the first year was with Backs Forward, which was meant to appeal to the broader campus constituency of staff, faculty, and students.
Thanks, Heather. So to give a little bit more background on these projects, the Student Ambassador Toolkit, as Heather mentioned, was meant to help college communities start COVID-19 student ambassador programs or build on student ambassador or peer educator programs that they already had going to focus on COVID-19 mitigation strategies like wearing a mask and physical distancing on campus. So a lot of campuses already have these types of programs in place to educate, have peers educate peers about relevant issues like sexual health or substance use. So it was a natural transition to provide materials that they could use to educate peers about COVID-19 as well. And I'll share a quick look at some of the materials in the Student Ambassador Toolkit here. Let's see, this one. So this is one of the main pieces in our Student Ambassador Toolkit. It is a program planning guide that colleges and universities can use to either start their own program or build on those existing programs. And it covers topics like what is a student ambassador, how to create a program that works for your campus, ways to get students involved, building partnerships, making your program inclusive, and tracking your success. So I'll just scroll through a couple of the images here so you can see the look and feel of these student ambassador materials. And these materials were really intended for campus staff to use side by side working with the student ambassadors themselves. So we went for this modern, playful look and feel that reflects the campus communities here. And the Student Ambassador Toolkit also includes a lesson plan and a communication plan that students could use to develop their own interactive workshop or their own COVID-19 educational materials on campus. And we also have some graphics here that students could use. If they're short on time, they can easily share those graphics on social media. And we also had some posters that people could print out and share around campus. Heather, did you have any other thoughts on the Student Ambassador Toolkit?
Just that we got really positive feedback. It was much appreciated. Again, a time when everybody was pivoting and trying to customize and tailor to their specific school culture and their specific environment as far as policies and regulations. And the toolkit was downloaded over 1,000 times, which was very meaningful to us given the broad constituency that we serve.
I think that was a really positive response on the Student Ambassador materials. And we also got some great feedback on the Vax Forward digital toolkit as well, which I'll share just a quick look at those Vax Forward materials here. So the purpose of the Vax Forward digital toolkit, this was created in 2021, right when vaccines were becoming available to a lot of students. We wanted to educate students, faculty, and staff about getting vaccinated and promote vaccination on campus. And this was also around the time when many campuses were returning to in-person learning and returning to some of those activities that in some cases had been postponed during the pandemic. So that's how we developed this tagline of Vax Forward to a Better School Year. And I think it's interesting to look back on how that has shifted over time. At this point in the pandemic, vaccines are not quite as much of a concrete ticket back to normalcy as maybe we once thought, or students once thought that they would be. But I think this approach really reflected where we were at that point in time as vaccines were becoming available. And here we have, we included some key facts about COVID-19 and vaccines. So just easy bullet points here that campus communicators can use to create their own materials to share with students, faculty, and staff. We also had some message strategies and examples. So really giving these campus communicators the tools to create their own messages and communication materials. And we had some easy to share social media graphics here as well. So plenty of examples there. And here's just a quick example of some of the messaging we included that you may have seen there on the homepage around why it's so important for people who live and work on college campuses to get vaccinated, and how vaccines can make it safer to do all the things that make college worthwhile. So Heather, any thoughts on Vax Forward that you'd like to share?
Well, I will say for both projects, the input from our students and our personnel in the field was really critical. And so as part of the process, Communicate Health met regularly with the working group we had of 5 students and 5 campus personnel that helped see the project through from beginning to end. And so Communicate Health was able to bring ideas and test those with the intended audience, which was really helpful. And I think that's what ultimately made for positive feedback and really good utility of the materials with our intended population. There was a question, Kathleen, around whether these were about the photography, whether it was curated or if you used a photographer out in the field to capture these.
Yeah, that's a great point. So these are actually stock images, and the Communicate Health team really looked for images that represented the diversity of campus communities, knowing that these materials were going to be used at campuses of all different sizes with different populations all over the US. So we chose images that kind of reflected the upbeat look and feel that we were going for, reflected that diversity, and also looked for a range of stock photos, including people with masks and without masks. And masks have continued to shift, obviously, throughout the pandemic, but at this point in time, this was when some campuses were taking away mask requirements, and it was shifting at that point. So we made sure to include a range of masks and no mask there.
And there are a couple more questions. One was on how did we evaluate or measure success with these programs? That was through, we were able to incentivize grantees. So campuses applied for very minimal support to help them facilitate either the student ambassador toolkit or the COVAC, the Vax Forward materials. And so we got direct feedback and metrics from those grantees to understand how they were using the materials and what their, and they applied with specific goals and metrics that they were going to document to measure success for their specific campus. So we have the preliminary reports on that on our website. And then the other question, I don't want to lose it. Oh, translation. So some of the schools that we were able to give grants to use that funding for translation. And then I don't think CH translated any of these materials, but I want them to confirm.
No, we didn't do any translation on our end. I think if we had more funding, that's definitely something that we would like to incorporate in future materials. And we do have some materials that we translated into Spanish on the next COVID project that we're going to discuss.
And then a question around readability and what tool do you use to test for reading grade level?
That's a great question. So at Communicate Health, we tend to follow plain language best practices. We use the CDC Clear Communication Index to test if materials are easy to read and use. We don't typically follow reading levels or use software that tests for reading levels, just because sometimes those types of software don't quite capture the nuances of what makes plain language communication effective. And what some programs or services might judge to be an 8th grade reading level, for example, another might judge to be 6th grade. So we find that those reading levels are not really an effective tool to measure some of the factors that we're looking at when it comes to clear communication. Any other questions on these materials? Great. So I think we're running a little short on time, so I'll move us right along to our next material here. We have our COVID in Focus series covering some timely topics like Omicron, the flu vaccines, and holiday and spring break safety tips. And COVID in Focus is a bi-weekly series, a little bit more or less depending on what's going on in the news, just covering those relevant topics that are coming up in conversation that are relevant to our campus audiences. And that was a good opportunity to cover some long-term communication needs like understanding natural immunity, de-escalating COVID conflicts on campus, and supporting people at risk of getting very sick as well. And I'll turn it over to Nicole to say a few words about our human-centered design approach to this project.
Thanks, Kathleen. Yeah, so on this project in particular, research was really a key step in our human-centered design approach. It helped us inform the creation of materials in a new and ever-changing information environment, which is what COVID continues to be too. So we ended up conducting a variety of research tasks kind of in parallel with creating various resources. So we reviewed existing literature, trend data, and resources about COVID-19 vaccination and hesitancy to really get a sense of what current data was already out there. And then we conducted a national survey with university students, faculty, and staff to better understand their knowledge, attitudes, beliefs, and perceptions of COVID and vaccinations on college campuses. And we also, from that survey, got a good sense of motivators and barriers towards getting the COVID vaccine. And another step in our research was conducting key informant interviews with staff or volunteers on college campuses. And these conversations helped us better understand the types of conversations that those professionals or volunteers were having about COVID and the vaccine. And then one of the last major pieces of the research task that we did to help inform these toolkits was conducting focus groups with vaccine hesitant students on college campuses. And we ended up doing focus groups with a variety of audiences, including those who identified as politically conservative, Hispanic or Latino, and Black African American students as well. And so with those focus groups, not only were we able to kind of reaffirm our findings from the previous research that we've done, but we also had the opportunity to test some key messages to really make sure we were on the right track with some of the materials that we had. And then we also, as Heather had mentioned a little bit earlier, really worked with the student and staff working group to kind of get real-time feedback on other toolkits. And we're currently updating the toolkits for this next school year based on some evaluation feedback. And I can pass it back over to Kathleen.
Thanks, Nicole. So just to reiterate some key takeaways that we learned from working on these materials, from all those focus groups and the research we did, we found out that college audiences really want more information rather than less when it comes to COVID-19. And they want people to be transparent about what we don't know and what scientists are still working to learn. So we've incorporated that into our messaging along the way. And of course, this probably will sound familiar, but we learned that addressing misinformation is the most pressing challenge for many campuses. So that was the focus of a lot of our materials, especially when it came to vaccination. And finally, adjusting strategy as new information becomes available is key to success. So I think pivoting as we move forward when it comes to how we're including masks in our materials, the types of messaging that we're using, and what's going to be effective for reaching campus audiences, those things will continue to evolve as the pandemic evolves, and we try to be mindful of that in developing our communication strategy. And I know we have a couple questions in the chat, but I want to make sure we have time for our group discussion today. So I think we'll save further questions on this project until the end and pivot to our next project, which is materials that we developed on behalf of the Centers for Disease Control and Prevention for people with intellectual disabilities. So CDC wanted to create COVID-19 resources for people with intellectual and developmental disabilities, like Down syndrome or Fragile X syndrome, for example. And the audiences for this project included people with IDD and caregivers who support them as well. So to meet this need, the CH team created a suite of materials about COVID-19 prevention behaviors. And I'll turn it over to Michaela to share a few details about these materials.
Thanks, Kathleen. Hi, everyone. So as Kathleen was saying, we created a suite of these materials about COVID-19 prevention, and they included vaccination, masking, social distancing, hand washing, and testing. And for each behavior, we created a few different materials to suit different learning styles. So these included videos, which were probably our most popular item that we created, social stories, which are short stories that illustrate what to do in certain social situations, posters, and also some interactive activities. And I think Kathleen's pulling just up the page on the CDC website where you can find all these, and I can chat this out. This is an example of one of our social stories. And so we recently, this contract year, we're creating a new suite of materials that focus on COVID-19 booster shots. And these were specifically designed for our Spanish-speaking audiences. So that was super exciting that we got to kind of create those and really tailor them for that audience. We also drafted tip sheets for caregivers with information about COVID-19 vaccines and the boosters, and how to talk to the person that they support about COVID-19 and how to use these materials. And then finally, based on these materials, we've been creating product development guidelines that the CDC staff and other health communicators can use when they are trying to help develop materials for adults with IDD and ELL, extremely low literacy. And this is just, an example of the product development guidelines. And it's similar to our Clear Communication Index, if any of you are familiar with that. So just moving on briefly to our human-centered design approach. So the company that we worked with to develop these with the CDC, RTI, they conducted the in-depth interviews. So there were dyads with individuals who had intellectual and developmental disabilities and their caregivers. And then our team at CH developed the testing stimuli, and we did all the iterative revisions based on all the feedback we got from this testing. And based on the research, we developed the best practices for creating communication materials for people with IDD, and then kind of that which helped to inform these product development guidelines that we just showed you. And I'll turn it back to Kathleen to run through some of our great key takeaways from this project.
Thanks, Michaela. So as we hinted at earlier, materials that follow plain language best practices may not always meet the information needs of people with IDD. One key issue is that it's really important for this audience to break ideas down into chunks. So for example, instead of including, say, vaccination and social distancing and masking all in the same material, we ended up creating separate materials for each behavior to really allow people to focus on that one behavior at a time, and then trying to limit pages to one idea per page and keep our sentences short and sweet to really break down that information. And of course, testing with our audience is key. And in this case, when it comes to COVID-19, there are a lot of abstract ideas around COVID-19 that we may talk about every day, but those were unfamiliar to us even a couple of years ago, and they can be difficult to explain to this audience. So testing helped us figure out how to address some of those more abstract things like germs, for example. In a lot of COVID-19 materials, you might see images or icons of germs, but we found that those didn't really test well for our audience. So we ended up leaving them out. And the same goes for things like time periods, like how long to wash your hands, for example, and social distancing. We ended up leaving numbers out and focusing more on concrete guidance that we could give the audience, like keep a safe distance from other people, and singing the happy birthday song as a way to judge how long to wash your hands. So that sums up our work on these materials for people with intellectual and developmental disabilities. And we can definitely address some questions on this project at the end as well. But for now, I want to make sure we have time to get to our group discussion. So I'll move on to the next part of our presentation here. In just a minute, we're going to be moving into breakout rooms to discuss your experiences with COVID-19 communication. And I've included some discussion questions here to help us get the conversation started. But this is just a starting point. Please feel free to share anything that comes to mind about your experience communicating about COVID-19. So a few of us are going to be facilitating breakout rooms, and Nicole, I think you can go ahead and split us up into groups.
And I'll just mention that we'll probably do, since there's a little bit more folks than we were anticipating, we'll do breakout rooms, but they'll probably be self-governed breakout rooms. So you might not have one of us in your room because we really want to have smaller groups for better engagement. So just as an FYI, we decided to change it on the fly.
Sounds good.
Okay, about to break everyone out into rooms, and you should have the questions in the chat as well.
Perfect.
Kathleen, it looks like we're unassigned. Do we just pick a room?
Yeah, I think we can just hop in.
Okay.
Yeah.
I will go to room 1.
Sounds good.
All right, welcome back, everyone. I think we're just waiting on everyone else to join us. Welcome back, welcome back.
I think everyone is heading back in from our small groups. So I know we only have a few minutes left. Just wanted to open the floor for anyone to share if there's any insights that stood out from your group or anything you'd like to share out.
I'll share from my group. One of our folks made the point that no one is teaching us how to confront misinformation and disinformation and how to deal with it with patience. And so we were all trying to think of resources that help with having the conversation and you know, losing the self-righteous attitudes and working with people and validating their concerns. And there's a little bits out there, but that training needs to be widespread, just how to get that message out.
Yeah, that's a great point. I think just validating concerns was something that came up in my group as well, really showing that empathy as a starting point and showing people that you understand where they're coming from and it's okay to have those questions. Any other thoughts or strategies that came up in your group discussions?
I can share something from my group. I didn't want to take the place of anyone, but in our group, one of my group members, I think her name was Jennifer, was commenting about how the language you use really does matter and how she's noticed in her community, people are using the phrases like mask optional or masks recommended. That's just one little example, but how they technically, she was kind of saying, and I just see you came off camera, Jennifer, so if you want to jump in, feel free, but they kind of mean the same thing, I guess, you know, but they, you know, they kind of convey, you know, recommended is showing this kind of different meaning versus, oh, the mask is optional. So Jennifer, I don't know if there's anything you want to add there, but I thought that was a really interesting point.
I think that sums it, up mostly, but I think there's just a lot of things because I work at a health department. So, you know, trying to convey certain messaging where we're saying, you know, not only what the science says, but what is recommended, then that kind of becomes, because I think like somebody mentioned also in our group, like about how even with COVID more than other public health issues I've seen has become very polarized and very, about kind of even who or how you use the language or what words are used. And so I think, but still, yeah, that those nuances do matter and can impact, maybe not necessarily that, well, it can might even impact the behavior. So I think just being thoughtful and mindful. And then we also looked at like, you know, what my county is doing is different than the next county. Sometimes what my city is doing is different than the rest of the state. Some like I went to school in New York State, and New York City is very progressive, but the rest of New York State is sometimes not so much. So, I mean, you sometimes have to adjust that messaging also depending on your community.
Yeah, that makes sense. I think, again, just showing empathy and showing that you understand where people are coming from and being thoughtful in those language choices and the way that we describe either policies or what's required in a certain space can make a big impact on how long or how likely people are to do what we're asking of them. So I know we are right at time. So just wanted to say thank you to everyone for joining and participating in the conversation today. It's been great talking with all of you and hearing about your experiences with COVID-19 communication. And we hope you enjoy the rest of the conference.
Thanks for coming, everyone.
Thank you. Great session.
Thank you.
Thank you.